health of Black men in America is in a state of crisis, a fact that demands urgent attention and action. Regular doctor visits are crucial for maintaining health, yet a significant number of Black men systematically avoid them. This widespread neglect not only threatens their health but also burdens their families and communities. The reasons behind this avoidance are complex and multifaceted, including systemic barriers, historical distrust of the medical system, and cultural views about masculinity and vulnerability. By understanding and addressing these factors, it's possible to encourage more Black men to seek regular medical care, potentially saving lives. This essay explores the serious risks associated with neglecting medical checkups and discusses the systemic and cultural obstacles that contribute to this health crisis. Through a mixture of statistical evidence and personal stories, a compelling case is made for why this dangerous trend must be reversed. Statistics reveal a grim reality. Black men have the lowest life expectancy of any demographic group in the United States. They are also more likely to die from heart disease, stroke, and diabetes at younger ages compared to their counterparts from other racial groups. These figures underscore a dire need for intervention. Moreover, studies show that Black men are less likely to have regular doctor's appointments and are more likely to be uninsured. This lack of healthcare engagement contributes to later diagnoses and poorer outcomes in diseases that are otherwise manageable or treatable with early detection. Continual neglect of healthcare can turn manageable conditions into fatal diseases without regular checkups. Many Black men miss the opportunity to detect serious health issues early, severely diminishing their chances for effective treatment and recovery. The reluctance of Black men to visit doctors isn't merely a matter of personal choice. It's deeply embedded in historical and cultural contexts. For many, there's a palpable fear and mistrust towards the medical establishment, which can be traced back to unethical medical practices like the Tuskegee syphilis study. Culturally, there are also strong notions about masculinity that equate seeking help or showing vulnerability with weakness. These cultural views discourage not only visiting doctors, but also discussing health issues openly, which exacerbates the problem of late diagnoses. Moreover, the lack of Black physicians adds another layer of complexity. With fewer doctors who understand the cultural and social nuances of their lives, Black men are less likely to feel comfortable and understood in medical settings, further discouraging them from making appointments. While cultural and historical factors play significant roles, socioeconomic status profoundly influences the health outcomes of Black men. Living in economically disadvantaged areas often means less access to quality healthcare facilities, limited healthy food options, and greater exposure to environmental pollutants. These conditions can lead to higher rates of diseases such as hypertension, diabetes, and heart conditions, which are prevalent in these communities. Experts argue that the stress associated with financial instability and living in high crime areas also contributes to deteriorating mental and physical health. We hear from Michael, a 45-year-old resident from an underserved urban area who shares his challenges in accessing preventive health care and managing chronic illness amidst financial hardships. His story is not just a personal struggle, but a reflection of a widespread issue affecting countless lives across the nation. Education and awareness are pivotal in tackling the health disparities faced by Black men. Studies show that higher levels of education correlate with better health outcomes. However, Black men are less likely to receive health education that resonates with their cultural and personal experiences, leading to lower engagement in preventive health measures. Initiatives aimed at increasing health literacy in these communities are crucial. For instance, community health workshops and culturally relevant health information distributed through local media can make a significant impact. We meet Dr. Simmons, a public health educator who emphasizes the importance of tailored health education programs that address both the medical and cultural needs of Black men. Through his workshops, attendees learn not just about diseases, but also about the importance of regular health screenings and lifestyle changes. By bridging the gap in health education, we can empower individuals to take proactive steps towards healthier lives, potentially reducing the prevalence of chronic diseases that disproportionately affect them. Community involvement plays a crucial role in addressing the health disparities among Black men. By fostering a supportive environment, these initiatives not only educate, but also empower individuals to seek regular health care. We hear from members of a local health advocacy group who share their experiences. John, a group member, tells us, being part of this community initiative changed my perspective. I realized the importance of getting regular checkups, which I previously neglected. These groups often collaborate with health professionals to provide accessible health services and screenings in neighborhood centers, making it easier for individuals to get the help they need without facing common barriers. Michael, another group participant, adds, it's about trust. Seeing doctors and health workers involved in our community events helps build trust and encourages us to maintain our health proactively. Through community-driven efforts, the gap in healthcare access and education is gradually closing, offering a beacon of hope and a model for other communities facing similar challenges.
As we delve deeper into the issues surrounding the health of Black men, it becomes evident that change is not only necessary, but possible. It's time to transition from awareness to action. Community leaders and healthcare professionals are stepping up, urging everyone to play a role in this vital movement. Dr. Simmons, a community health expert, emphasizes each one of us can make a difference, whether it's by educating ourselves and others, advocating for better services, or simply supporting community health initiatives. Actions can range from attending health workshops to volunteering at local health drives. Lisa, a public health advocate, calls on the community, let's unite and organize health fairs that can provide essential services like blood pressure screenings and diabetes education. Your involvement can save lives. We also see local gyms and wellness centers offering free health and fitness classes, aiming to encourage regular physical activity among community members. This scene is a rallying cry to all viewers. Get involved, spread the word, and contribute to a healthier tomorrow. Your actions, no matter how small, can lead to significant improvements in health outcomes for Black men.